Welcome to Phase 1 of Rethink Health's Pathway for Transforming Regional Health. So let's explore how groups get started on the pathway and steward an effort through Phase 1, the campaign phase. We'll address in this presentation key pitfalls and momentum builders of Phase 1. If you'd like to identify which phase your own effort is in, you can find the Pathway Self-Diagnostic Tool on the main Stewardship Guides page. By a campaign, we mean an intensive, time-limited effort that's focused on collaborating to solve a particular problem, bringing together resources from different organizations in the region. There are several different ways that the journey toward a transformed system tends to get started. Sometimes it's around solving urgent problems, such as creating access to care for the uninsured or reducing hospital readmissions. But sometimes it's also about longer-term aspirations, such as reducing the number of teenagers who take up smoking. But the main characteristics of the first phase of work on the pathway is that an array of well-positioned leaders come together from different organizations to accomplish a single goal or to solve a single problem. One example that we've seen of a very successful campaign is an effort in the Northeast of the United States to bring together many different groups, from families, community organizations, nurses, social workers, to prevent children in the neighborhood who had asthma from winding up in the hospital so frequently. They organized a whole series of approaches to reducing asthma triggers in the home, supporting families, and helping children avoid severe bouts of asthma so that they didn't need emergency care. This effort was extremely successful in that it reduced the rates of emergency room visits for children with asthma by 50% and inpatient visits by 45% within 2 years. We're going to cover 3 different pitfalls of the campaign phase, and then we will address each one in turn by describing the momentum builders that leaders can put in place to help avoid these pitfalls. Campaigns can bring together groups and organizations that haven't worked together before, and they can result in those groups putting resources to solve a problem of genuine importance for the residents. But the campaign phase of health system transformation is also a stopping place for many regional efforts. It becomes a stopping place precisely because the campaign is so successful in solving a problem. The typical pitfall of this first phase is that a campaign fails to be a platform for greater collaboration and broadening scope because it was intentionally thought about as a short-term arrangement focused on a single problem. When the organizations involved in a campaign define their purposes as solving one particular problem and mustering a lot of resources to do so, a couple of consequences arise from that way of seeing their shared purpose. First of all, defining the purpose of the collaboration in that narrow problem-solving way as something that'll require close collaboration for a short period of time is a self-fulfilling prophecy. If the point is to work together for one short-term goal, that's usually where the integration stops. Second, when a campaign has succeeded in building something new, there's often then a deliberate handoff from the senior leaders who have the power to decide to work together with other organizations. Leaders like hospital chief executives or directors of public health, community leaders, those who were the original source of authorization for the campaign, hand off the leadership of the effort to more junior people, operational managers who can keep the project going. Project leadership of one collaborative initiative is not stewardship. Stewardship means a group of well-positioned leaders who are willing and able to take responsibility for the effectiveness of the health system as a whole and who lead together on behalf of that system and not just on behalf of their own organizations. The third typical pitfall of this first phase is that when real progress happens on the problem it was intended to solve, ironically, the people involved then lose the motivation to do more. There's certainly something satisfying about seeing something done in a new way, and that satisfaction is a positive thing, and it can serve to be a real motivator to think about what other changes in the health system might benefit from the collaboration that we just built. But the people who are involved in an intensive campaign burn a lot of energy and resources doing so, and that work is usually not the main focus or purpose of many of the organizations involved. So they develop the feeling that when progress has been made on this problem, we've done enough. We're satisfied. We've seen from our research about great collaboratives that when one begins with a narrow problem focus, it's hard to turn that around. The motivation that comes from focusing on a negative, on a problem, is not as powerful as the motivation that comes from a big aspiration. It just doesn't keep people coming back to do more. And secondly, when the purpose starts as a single campaign, one effort with a big short-term push, then trying to broaden the scope of that purpose for those leaders who already came to the collaboration for a narrow purpose can experience that attempt to broaden the scope as a kind of bait and switch. It's not what they agreed to sign up for in the first place, and that change of purpose in midstream can then risk leaders walking away as a consequence. So now let's turn to some momentum builders that leaders can put in place to avoid the typical pitfalls of the campaign phase and continue progress on the pathway. One of the most important momentum builders for moving beyond a single campaign is planning that campaign from the start as a first step in an ongoing collaboration. Articulate the purposes in terms of aspirations. We find that doing so is a very different experience for leaders than it is defining the purpose as solving one problem. An aspiration is a big, inspiring picture of a future that is better in many ways for the residents of a region, including the groups and organizations that are entering the collaboration. It's a source of positive motivation, of energy that can be focused on working together around many smaller efforts and problems. We know from research that an aspiration focus, a positive vision, opens people up to learning and to risk-taking and to innovation in ways that solving a single problem cannot. For example, one way we've seen something big, aspirational, and truly regional get started is when the hospitals in a region decided to undertake the required needs assessment together rather than separately. Putting their resources into that shared effort is in itself a kind of campaign, but it's one that sets the stage for the same group of leaders to ask a bigger question. Could things be much better in this region if we work together to address some of these needs? What are some of the first things we could do together that will make a positive difference? A common needs assessment is only one starting point. There are many ways that determined leaders can get momentum for bigger aspirations going. But the underlying principle is to help people see that continuing on the current path is not acceptable, that the consequences of doing so are very poor for many residents, many organizations, and many groups in the region, and that something much more positive is possible. One powerful tool for developing aspirations and showing how the status quo is not acceptable is to engage in the narrative practice that we call the story of now. A story of now is first and foremost a story. We know from research that people see themselves in stories, that they respond to stories, characters that they can relate to, challenges and choices that inspire them, narratives that bring pictures to life, far more than they do to abstract summaries of problems that are expressed in numbers and charts. Of course, numbers and charts are critical for defining the size and scope of the problems that we care about, and for developing measures that will tell us when we're making progress. But it's stories that engage the values and hearts of people and can serve as the motivation to join something bigger than themselves. In the tools section of this guide, you'll find a tutorial on how to develop your own story of now. You'll experience how powerful narrative can be in mobilizing people to work together for some aspirational purpose. The basic structure of a story of now is to describe both the nightmare, what will happen if we don't work together to change our community, and the dream, what's genuinely possible if we take responsibility for working together in different ways than we do now. With a strong, aspirational story of what might be possible, champions of a better health system for all can draw upon many potential stewards, people across organizations who can together take responsibility and bring resources to significant, lasting changes. They can start imagining not just one project, but many different efforts that together will bring about a whole different future system. We call this initial group of leaders system champions. These are individuals who are willing to take responsibility for leading change and for getting something large started. They must be a very diverse group, a group of leaders from all the key sectors and institutions that influence health. Public health, healthcare providers are obvious ones, but we've seen that most successful efforts in the long run also have a broader array of stakeholders involved early in the process to help shape the choice of aspirations and projects to undertake together. Those groups might include local government, social services, education leaders, community organizations, as well as the employers and insurers who help to finance healthcare. And these groups could be working on issues as diverse as transportation, community planning, environmental protection, many other kinds of challenges. What makes them system champions is how well they are positioned to understand how all the parts of the system work together because they have so many different perspectives at the table. In the Phase 1 page of the Stewardship Guides, we offer a tool called Mapping the Scope of Your Effort. It'll help you to reflect on how broadly you're defining the purposes of your effort and whether there are additional system champions that you could be bringing to the table. If you've identified your change effort as presently in about Phase 1, the campaign phase of the pathway, and if you'd like to learn more about how you can focus your activities to build more momentum for change, the Developmental Assessment can help you understand more about what the strengths and weaknesses are of your regional effort. Rethink Health, working with many leaders like you around the U.S., has identified 11 conditions which together greatly increase the chances over time that real transformative change takes root and leads to greater and greater impact and ultimately to a radically better system of health. Each of these 11 conditions, from diverse system champions through building a local culture of health, is an important part of your change effort at every stage of the pathway. The developmental assessment will help you rate your effort on each of these 11 conditions. And if you want to move beyond Phase 1 of the pathway, take a look at your scores on each of these conditions. The more that are scoring 2 or better, they're at least Phase 2 on the pathway or better, the more momentum you have going for your Phase 1 effort. We have covered in this presentation some of the key pitfalls and momentum builders of Phase 1, the campaign phase of regional health transformation. In the next presentation, we'll cover the second phase of the pathway, the engage phase, and we'll explore what's involved in stewarding an effort into and through Phase 2. You can find an overview of the pathway and all the tools and cases that